Hi, I am Dr. Mandar Agashe, a consultant pediatric orthopedic surgeon at the SRCC Children's Hospital managed by Narayana Health, Mumbai. As a pediatric orthopedic surgeon, one of the commonest complaints which kids have is an injury to their elbow after a fall. Kids are typically playful. They are jumping from all over the place and they are falling down at least 10 times a day. What happens is, in one of these falls, the kid falls on what we call as the outstretched hand. That means that the kid falls right on the hand, and the impact most commonly is felt by the elbow, which is probably the weakest part of the upper limb. Elbow fractures in children are some of the commonest fractures which a child can have, and probably almost 1 in 5 kids worldwide have an elbow fracture during their childhood. These fractures range from the most benign, which can be treated with just a sling or an arm pouch, to complex, which require complex surgeries for their management. What is important for you as parents to know is that once a child falls on an outstretched hand, and if you see even a slightest bit of swelling around the elbow, that is the time when you should seek medical attention. If you are not able to get medical attention, simple things like using a small dupatta or a piece of cloth to have it like a makeshift sling, that will relieve the pain of the child. What you can do is you can ice the part lightly so that the pain and the swelling can reduce, and you can give him or her simple medicines like a syrup of paracetamol or ibuprofen. You should seek medical attention as early as possible, where the local pediatric orthopedic surgeon can get x-rays of the child, and if required, further imaging can be done. Depending on the x-rays, the treatment can be done, which is usually what we call as an above elbow plaster, and in some cases where the fracture is completely displaced or completely out of its place, it can be brought down or brought in place with the help of simple surgeries which are minimally invasive. These are scarless surgeries and give the full function of the elbow back to the child. Thank you very much.